I represent a very big innovation state. And innovation in healthcare specifically, innovation like NIH funding to the Fred Hutch Cancer Center that helped develop the HPV vaccine, which has the potential to eliminate over 95% of cervical cancer.
Oh boy.
NIH
He does not like the word vaccine.
also funds a lot of jobs and grants, nearly 11,000 people in the state of Washington and over $1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit. But the most striking example of this is when COVID hit. And we were the first in the nation. We had the first case.
I believe that RFK Jr. doesn't believe that COVID was real, or he doesn't think that I don't remember what his position is on it. But does he think it was like created in a lab? I'm not even sure.
And it really was the fast response by the University of Washington that really helped save lives. So I just want to know that, are you aware of how harmful these issues could be for public health? That public health in and of itself could be affected by these kind of anti-science views?
Senator, I have always been a science person, a pro-science person. I believe in evidence-based medicine and gold standard science. When I said, and I've explained this before you came in, that 600 people out of a workforce of 91,000 is pretty typical. Last year alone, President Biden replaced 3,000 people at HHS and 700 at NIH. I want to say this. I said give infectious disease a break because that's been the principal preoccupation. Infectious disease.
All right. So what he's saying about Biden replacing people here, this is an outlying case because that's when things started to get politicized. I don't even know if what he's saying is true. He straight up lied in this thing. Not even just a few minutes ago. He just lied outright, blatantly falsified information. So I'm hesitant to believe a word out of his mouth on this. But you'd have to go back to Obama or Clinton or even Bush or whatever to get accurate numbers or numbers that more closely represent reality.
That's been the principal preoccupation.
So when he says give public health a break, I guess he means stop paying attention to infectious diseases, right?
Infectious disease a break because that's been the principal preoccupation. Infectious disease, chronic disease is 92%, accounts for 92% of deaths in this country, and almost nothing is studied at NIH about the etiology of our chronic disease epidemic.
Our chronic disease epidemic. I'm not sure which chronic disease he's referring to. My dad had chronic back pain. Some people have chronic, like, anxiety or depression or whatever. Which chronic illness are you referring to? Chronic illnesses are studied by universities all the time, which, by the way, receive federal funding. So the government is studying chronic pain. The NIH's responsibility, though, is like infectious illness that can't be solved, or that it's not cost effective to solve by a university instantaneously. Like, it requires the best minds in the world coming together to solve rapidly. So I'm not even sure like what he's talking about, but this is yet another example of him twisting things around, morphing it into something that it's not, in an attempt to give people an impression other than reality. Once again.
But right now,
money is going to infectious disease.
But I get your point. It's an interesting point. The problem is we had to respond, and it's actually the Gates Foundation and a flu cohort that figured out what was wrong, and that we had an outbreak of COVID that was going beyond the very first case. And so we had to build a very fast response. So I take this to the University of...
Like, they had to study how to make COVID tests in the first place and stuff. And it was all like it needed to be done now because every second that was wasted, every 8 hours that one of these scientists was asleep for the night, thousands of people died, maybe tens of thousands for every single night that was delayed, tens of thousands more would eventually die. This is not something that the private market can solve or would have any interest in solving or would be able to solve or whatever. This is something that the government, this is why we have the government, for this exact thing right here.
Washington has conducted groundbreaking stem cell research on fetal tissue. To me, I know there's probably a lot of people that may not agree with this, but we're making regenerative heart tissue now at the University of Washington. So yes or no, do you commit to protecting stem cell research for scientific agencies if confirmed?
Oh my God, that would be fantastic. I don't know if you guys know how this works, but just in case you're unfamiliar with it, stem cells are basically cells that haven't been given instructions yet by like the DNA to be what they will eventually be. They're blank templates. They're template cells. So you can basically feed in the instructions to become a liver, and you can give the stem cells the DNA to work off of. So if somebody's liver has completely failed and they are going to die of liver failure, you can grow a new liver for them using stem cells and give them, and there won't be like fear of rejection or anything because you're using stem cells to do it. The reason that Republican nutcases don't like this is because one of the ways of getting stem cells is through umbilical cords. If people want to donate umbilical cords, they can do that. Also, when your teeth fall out when you're little, they have stem cells in them. The other option to retrieve stem cells, I mean, we could probably do the research just on umbilical cords. It would just be really slow going. The most efficient way of getting stem cells is to take an egg cell and a sperm cell and put them together in a petri dish for 3 days, and boom, you have like 100 stem cells. Or like 150 stem cells or something, and that's it. Now, the Bush administration, I believe, first outlawed this. But for one thing, it's not a baby. It's literally like 150 stem cells. That's it. And B, the number of lives that it saves are innumerable. Like, the scientific advancements that can be had studying stem cells, like, it can't be overestimated. It is so incredible, this research and what it does for society. So anyway, I am all in for stem cell research. Hard to do embryonic stem cell research, but I know a lot of people doing iPSC research, which is a way to make a normal cell into a stem cell. Oh, interesting. So is that the most common version, iPSC research? Making a normal cell into a stem cell? That'd be fantastic. So stem cell research, I guess, doesn't even require the egg and the sperm cell. You can just make a normal cell into it, and now it's just fear-mongering trash, apparently. Like, it's meaningless fear-mongering trash. Why people wouldn't want to do stem cell research. There is no legitimate reason whatsoever to not do it. The point of stopping cancer research is to get people to die off. This is all about weeding people out of population. Religious reasons are the shield. They're also making it so health insurance can deny you more easily for pretty much most illnesses. It's about killing off the weak for them. You think? I don't know. That was Hitler's reasoning, but I'm not so convinced with the United States. I think that these people are just genuinely inside, they're heartless. There's nothing in there. It's hollow. They're just complete pieces of shit and want to virtue signal about how shitty they are as human beings. I think they enjoy showing people how completely fucking disgusting they are. That's my take on it. iPSC is the most common type. Typically start using skin cells. Okay, there you go. So there genuinely is no reason. There's no reason not to do stem cell research then. It's just complete trash.
I will protect stem cell research. Stem cell research today can be done on umbilical cords, and you don't need fetal tissue.
you'll protect the laws that are on the books today and the research that's done.
My job is, Senator, to enforce the laws.
Okay, so I want to move to PBMs.
Actually, I believe his job is to craft the laws also, right? To help guide the direction of the legal system.
Because PBMs are driving up drug prices. And one of the biggest things that we need to do here, I think, in a new administration, is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this.
Is all the stem cell research pretty much mostly associated with anti-Planned Parenthood, pro-life nonsense? Yes, 100% completely and totally linked with that. But I guess they don't even need fetal tissue. As RFK Jr. said, and as Super Nerd said, they don't need fetal tissue to do the stem cell research anymore. Now it's basically like people screaming that they don't want the vaccine because they used aborted babies to make it. No, they didn't. That's completely made up, just fictitious trash. But that's guiding public policy anyway, despite being trash.
To basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was. And President Trump, during his first administration, pushed through a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know.
Okay, that's a no. By the way, I believe that the Constitution says that the president will basically choose the nominees, or he'll choose the department heads with the advice and consent of the Senate. My interpretation of that is probably wrong because I'm not a constitutional scholar, nor have I even read the damn thing. But my interpretation would be the Senate gives the president a list of nominees to choose from, and then the president picks one of those nominees that they chose, and then they grill the person and vote on him. That's my take. I don't know. I think that'd be a better system, in my personal opinion, because the executive branch wouldn't be so, top-heavy, so powerful, if the Senate was more involved in the picking process, I guess you could say.
But I think that we need to reform the PBMs. I think we need to get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested, though, that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off. Really, they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't.
He is absolutely being evasive. God, it drives me nuts how he can't just answer a damn question.
Know exactly what the law is.
This is like the most mild line of questioning, too. He can't answer even this.
Says, I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side. Well, that doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high-quality health care.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing.
Like he gives a shit. She says, I would ask you to look at this. Like he's going to look. He is an ideologue. He already knows exactly what he's going to do and how and when and why. And there's no other information that he's going to take in that's going to change it, in my personal opinion.
To drive up prices and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions, but I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
I'm sorry, one more time. Let me step back.
You stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Right, because he spent the past hour or something tearing down Medicaid, saying that it's terrible, it's not doing anything for anybody, but it is. It's actually working better than nothing. In fact, Medicaid's actually awesome. I used to have Medicaid, and I had a terminal illness that I survived. Actually, it was like I had a 40% chance of survival, and I made it through the other side because of Medicaid. They spent $120,000 on my treatment. $120,000 Medicaid did. Now that treatment costs $5,000 because they've gotten a lot better at it. But you have to be in stage 4 organ failure before they will give you the treatment now for this treatment. Seriously. It's so much easier and cheaper to treat, but they won't do it now for practically anybody. So I like Medicaid a lot. It's done so much for so many people, but it's trash now because of people like this that have cut down on what it does. It's really sad. And sadly, even sadder than that, I know somebody that has this condition and they're dying. But again, they can't get it. They can't get the treatment until they're in organ failure. Really.
Yes, Senator.
Mr. Kennedy, do you know how many
Stage 4 is death. Stage 4, I'm trying to be vague because I don't want to get into it. It's not cancer. It's a specific type of failure that basically means you need a transplant at that point. There's a small window between entering stage 4 failure and having no other option but to get a transplant. If you reach that window and get approved for treatment and get the treatment in that window, then you can take medicines to keep you going for the rest of your life to treat that illness, versus just giving them the treatment now before it's even a problem and not needing medicine or any of that other shit. So basically, they narrowed the window to make it so that almost nobody needs the treatment, because by the time they get the treatment, they're on death's door. So 50% might make it and 50% might not. They narrowed the window to make most people just die of it. That's the point. Again, I don't want to get into it too deeply, but yeah.
Americans rely on Medicaid?
It's about 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million.
I think it's CHIP, Children's Health Insurance Program, but okay.
Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer.
I would guess 20%, maybe 30% of mothers have children on Medicaid.
I would guess about that is in 30 million.
30 million? That's 10%, I think. No. You know what? I'm not. He may actually be in the ballpark of where I was. I don't know.
Have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed.
41%. 41%. Wow. 41% of babies are born on Medicaid. Fascinating.
Financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be.
Right. So just throw money at it, more money, expand it, make it gigantic, give Medicaid to anybody that wants it, and, you know, make it available. Make it basically a public option. Make it available to everybody if they choose it. And you know what? If you want private insurance after that, go nuts. Get your stupid fucking private insurance. But everybody should have access to it.
President Trump has asked me to make it work better, that most Americans are not happy with it. That the premiums are too high, the deductibles are too high, and everybody's getting sicker.
Wait, premiums are too high for Medicaid? Are you aware of what Medicaid is? Have you ever heard the term before, Robert F. Kennedy?
Too much money is going to
Mr.
the
Kennedy?
insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard
Yeah, shut the fuck up and answer my questions.
we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82.
Again, I had Medicaid. They paid $120,000. It was between $115,000 and $125,000 estimated based on how much the medicine cost. I think some of the medicine I was taking was like $800 per day is what I was taking. It was crazy. Medicine's been discontinued now because of the side effects, how intense. It was basically like chemotherapy. Anyway, they paid a ton of money for me to live, and now I'm paying that back, and I'm doing it happily with a smile on my face. I'm glad to. Because I know, well, because I would like to think that the money that I put back into it is helping somebody else that was in my position. But not really, actually, since they've made it more difficult to get treatment in the first place. That's not really happening. My money is just going into this guy's pocket, actually, instead of helping somebody survive. Countless people are dying rather than surviving, like I did, because shitheads like Robert F. Kennedy Jr. are pushing to like end Medicaid and stuff.
2% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
Call it a restroom break.
President Trump has not told me to that he wants to cut Medicaid. He's told me to make it better.
And what do you think Trump meant when he said make it better? He obviously, every Republican wants to cut Medicaid into the ground, of course.
Do you support cutting, yes or no? Let me ask you this way, since it's only about
I
President
support
Trump.
making it better, Senator.
Okay, that's not answering the question. That's pretty clear. When you won't answer the question, it's pretty obvious to me that you want to cut it. right? RFK sounds like he's coughing more than speaking. Yeah, I think he had like a voice box surgery in the 80s or something like that. I don't remember. If you survive but go bankrupt due to medical debt, did you really survive? This is a bad way to live, so don't take your advice from me. I am of the opinion that I personally don't pay bills that I don't feel I should pay. It's ended badly in the past for me, so you really shouldn't do that. But like, you know, if I went to the hospital and got like my appendix taken out or like my spleen taken out, that almost happened once. They thought they were going to have to take my spleen and they charged me $150,000 for it. Go fuck yourself. I'm not giving you shit. You can. Oh, and you know what? Next time I get sick, your stupid ass is going to treat me then too, because it's illegal not to treat somebody in the emergency room. So, you know, get fucked, losers. No, that's a bad way to live, in all seriousness. You shouldn't do that because it ruins your credit. It's difficult, nay, impossible to get a place to live if your credit is wrecked like that. You know, getting a job is difficult. Getting a car, like living is practically impossible if you have debt that is unpaid. It's like a nightmare. So anyway.
If President Trump asked you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress. And
that's not that wasn't the question.
And
you don't want to answer?
I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end? Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said,
i.e., wow, dude. So this guy just said there are people with signs in favor of Trump in the crowd, and you are taking out the people with signs that are opposed to Trump and leaving the ones that are in favor. That's disturbing as shit. Seriously.
We should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just hope that we can.
Senator Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
It's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if in fact that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion.
I don't think I do. I'm not sure that I believe RFK gives a shit about anybody, honestly. Like the dude, I think it was maybe his aunt came out recently and basically said, wait, did I miss a shrine? I missed a shrine. Oh no, I missed a shrine. Wait, did I not actually go inside of this shrine? I didn't. Oh my God, I'm so ridiculous. Anyway, I think RFK Jr.'s aunt maybe said basically when he was younger, he used to put chicks and mice into blenders to feed to his hawk. And that shit is like disturbing to me. Like I keep coming back to that and thinking about how fucking disturbing that is. That somebody could do something like that. And it makes me wonder if this guy is even capable of feeling empathy for other people or creatures or whatever to do something like that. That is like really, really like just disturbing to think about alone, just to think about.
My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So
I'm not sure I understand what he means by that.
what are you going to do when?
Oh, is he saying that, like, if they're in the placebo, then the placebo doesn't help?
If they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
Oh, I see. Interesting. So, like, if Mexicans are not included in a clinical trial, then the medicine often doesn't help Mexicans. That's interesting. I wonder why. Because I imagine because they have to, like, go back and they have to, like, tweak the chemical composition or something to make it a little bit more kind of widespread. I'm not sure. Huh.
I'm going to do everything I can to make sure there's Native Americans in clinical trials.
Bro, that's DEI. You can't do that. Remember Trump talking all that shit about DEI? That's DEI.
As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, a failure to deliver good health results or health care on the reservations. I'm going to bring a Native in for the first time in history into my central office.
That's DEI.
That all the major decisions in my office will be that he will have it. We've already interviewed a candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
just repeat that again. I'm sorry.
Will you
Senator.
commit to finalizing the congressionally mandated?
In my opinion, RFK Jr. is trying to stall with this kind of shit. He's asked people to repeat the question like 6 times through this whole thing. I don't believe that he's having trouble hearing it. He's just stalling.
Just repeat that again. I'm sorry.
Will you
Senator.
commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you
That's a big deal. Again, that's DEI. I can't believe he's saying that.
commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks out
to
there doing the
working
work.
with you to make sure
Kennedy-
those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote,
Oh no, Autism Speaks. I understand, like my sister she's an anti-vaxxer, or she was. I'm not sure she still is, but she apparently used to be like very deeply embedded in Autism Speaks, I believe. This like this conspiracy autism network that blames vaccines for shit and all of that. And I believe that she stopped working with them because, I don't know, they were advocating for a cure to autism. I'm not really sure. It's been so long since I talked to her about this, but to my knowledge, Autism Speaks is absolutely out of their heads, is the point here. I love hitting these chickens, getting chased around by chickens. It's so funny. Wow, they take down my shield, like my barrier. The orange barrier doesn't even protect me from these little bastards. That's crazy. I'm getting bodied by these chickens. Anyway, aren't Autism Speaks the ones who want to cure autism? Yes, okay, maybe that is what I was thinking of. My sister doesn't want to cure autism. I don't remember. Yeah, I don't know enough about it to speak on it any more than I already have. But, yeah, it's obviously a complicated issue. It's not as simple as just trying to cure it. It's not as simple as vaccines are causing it. They're not. Anyway.
Do vaccines cause autism, end quote. And I'll note that the
I'm sorry, let's step back.
unanimous consent to enter into the record an article from Autism Speaks titled, quote, Do Vaccines Cause Autism, end quote. And I'll note that the first sentence states, quote, vaccines do not cause autism, end quote. Thank you. I yield back.
Without objection. And before we move on, we've had a request from several quarters for a quick restroom break. We will take a 5-minute recess. I'm sorry to those remaining 5 or 6 senators who must wait a few minutes, but we will have a quick break. We will be back as soon as we can.
Okay, now they're clapping. Oh my God, this is psychotic. Who in their right minds could possibly clap for RFK Jr.? Really, this guy his head is shot. His head is just gone. I mean, no joke intended about saying that his head is shot, considering who he is. That was not intentional. Anyway, his head's just gone. Like, his mind is gone. He has no idea what's going on. He's completely, out of this universe with the things that he believes. Okay, everyone go take a leak, right? Anyway. Yeah, tell me what you think about it in the comments. That's just wild, man. Wild.